Let's look at antiparasitics, part 3, ectoparasites. So the world of ectoparasites, as you guys come to know it when you start working in vet clinics, ectoparasites are a big problem. And more so lately, we're getting into issues around fleas and ticks, especially ticks with zoonotic potential. So just going back, if we reflect on one of the first PowerPoints that we did regarding parasites and antiparasitics, in Canada, who regulates what? So we're going to start to talk about different types of antiparasitic products. And remember the difference in regulation between regular vet products and vet drugs and some of the topical flea or tick products. In Canada, the Food and Drugs Act and Health Canada regulates vet drugs, and then Pest Control Products Act regulates some of the topical flea and tick products. So in general, if a product requires systemic absorption for its full effect, then that is the Food and Drugs Act, and those are legend drugs. So it means that it's a prescribed drug through the veterinary clinic. But if it remains on the skin, then typically those ones can be controlled through the Pest Control Products Act. Generally, that's completely generally, because there's definitely some exceptions to that rule. So how do ectoparasiticides work? We have generally 4 pathways of activity, and the activity involved neurotoxic activity. So they either inhibit neurotransmitters, they could enhance neurotransmitters, they may block neurotransmitter receptors, or they may enhance neurotransmitter receptors. And of course, why is this important to us? We'll talk about some of their potential toxic effects. And knowing whether the target receptor or the neurotransmitter of the ectoparasiticide is excitatory or inhibitory enables the RVT to understand the possible toxicity signs that could be seen in the animal. So we'll definitely get talking about this when either an animal eats too much or gets too much of a product, or if the wrong species gets a product that they're not supposed to get, then we start to see the effects that might happen on the parasite are now happening on the host. So looking at external parasites, or ectoparasites, for small animals, we're most often concerned with fleas, with ticks, with mange, which is of course mites, or with lice. Horses, we're often looking at flies and reduction of flies, which of course with flies comes bots and maggots. And livestock, we're most often again looking at flies, and then we also get into issues with grubs and lice. So it depends where you are in the country. Fleas are definitely the most common, and ticks are a top number 2. And then if you get into certain areas, you get pockets of small animals getting lice, very common in certain communities, and of course mites. And not just mange-based mites, but mites like ear mites are really common as well. So in general, we're always looking at fleas as our number 1 concern, especially in southern Ontario. So the purpose of control of ectoparasites is to decrease skin disease. So if we're thinking about small animals, we're often seeing that flea allergy dermatitis, where they get bumpy little papules all over their skin because they're getting a localized reaction. In livestock, we're looking to increase weight gain. So if they are burdened with ectoparasites, they tend to lose weight because they're not eating as well, they're irritated all the time. And then really important now is to control arthropod vector diseases. So looking at Lyme disease, which is totally creeping up in Canada, Rocky Mountain spotted fever, bubonic plague, etc. So I always think it's wild to think that the bubonic plague still exists. This was the plague of hundreds of years ago. And then going to California a couple years ago, I guess, when we went to California, they still have signs that say, do not touch wildlife, do not touch mammals that are wildlife, because currently they still have an issue spreading bubonic plague from fleas. So of course I read this sign as I'm petting 2 stray dogs that came running up to me, and my husband looks at me like, what's wrong with you? Did you not read the sign? No, clearly I had not. But they definitely still have issues spreading bubonic plague through fleas. Not fun. Formulations for ectoparasite control, we have collars, powders, dips, sprays, baths, foams, pour-ons, topicals, rubbing bars, dust baths, or dust bags, feed additives, etc. So it's on and on and on. The key here is we have to choose the right product for the right species. And as mentioned before, the most common parasite in companion animals is definitely the fleas that we're always after. And considerations with flea products, we have many different products, and products may target specific stage of flea life cycle. So they may only get the adult fleas, they may get the eggs, and then most products do not get the pupa, which is the hardest cycle of the flea life cycle to penetrate. So we need to understand the normal life cycle of parasites in order to choose the right product for that patient and, excuse me, to understand the limitations of the products when we're treating fleas. With this, we have to provide clients the right information and expectations. So if we're giving a client a product that only treats the adults, we need to talk to them about this. Oftentimes, we end up pairing the product with another product that will help get some of the other life cycles. And of course, if it only treats the adults, we need to talk about how often retreatment should occur to ensure that the eggs that are now hatching are going to be killed, and that we talk about hygiene in their environment, to vacuum, to clean, to get rid of the other life stages that are just sitting dormant. So looking at the flea life cycle basics, the adult fleas hatch from the, oh wait, where am I at here? So adult fleas lay eggs after a blood meal, which then drop off into the environment. And then we have flea eggs, which are 50% of an infestation. The flea larvae hatch out of the flea eggs when conditions are right, so they love warm, humid environments. The flea larvae occur, and that's 35% of an infestation. The flea larvae spin a cocoon and develop into a pupa, which lasts approximately 1 to 2 weeks, and that's 10% of the infestation. And then, of course, the adult fleas hatch from this pupa and continue to infest the pet. Adult fleas are 5% of the infestation. So isn't that wild to think that the adult fleas are only 5% of an infestation? So if you have an animal that has a ton of adults on them, that's not even the issue. The issue are the eggs that are in the environment ready to hatch. And the most challenging of all these life cycles, like I mentioned before, are the pupa. The pupa, there are not many drugs out there, if any at all, that will infiltrate the pupa. So even if you get the larva, the adults, the eggs, there's a good chance you still have pupa hanging around in the environment. So looking at what many clients want when it comes to flea medication, they want low cost. Generally, that's the number one concern, especially if we know that it's going to take at least 3 months to get rid of a full flea infestation. And a lot of clients now are looking for natural products, organic products. So we have to have caution with this. This is a fad right now, and we've learned about fads. We know that trends are not always good for pets. And I'm going to use the example of the trend that's currently happening right now with grain-free food products for dogs, resulting in cardiomyopathy, so resulting in deadly heart disease. Just because it's trendy and just because it's really popular and heavily marketed does not mean that it's okay and that it's safe for the pet. And this is the RVT's role, is to educate the client about this. So right now, if you Google natural flea control, you're going to come up with using essential oils. You're going to come up with all sorts of different natural flea and tick repellents. Again, we've got oregano oil, home remedies. We've got black walnut hulls. We have people recommending tea tree oil, garlic. So there's a whole bunch of stuff that people are recommending. And I just want to draw attention that a lot of these can actually be deadly for animals. So even just looking at this organic facts chart here, I want to point out that black walnut is really severely toxic for dogs. Tea tree oil, if absorbed through the skin, is extremely toxic to dogs. And eating garlic is toxic to dogs. So keep this in mind, that not everything you read on the internet is good for dogs and good for cats, especially things like tea tree oil. Okay, what's good for humans is not always good for pets. The reality is many reputable drugs are available with numerous safety studies behind them. That is super important, and I will always harp on this. They actually have studies to prove that they work and that they're safe. They're not just clinically formulated. They're not just hypothetically formulated based on other data results. They're clinically tested. Many of the natural herbal oil remedies are anecdotal, meaning that they don't have studies to back them up. And it's a great ideal, would be nice in an ideal world, but in the end, it can actually cause more harm than good for the pet. So let's look at our ectoparasiticide classes. We have organophosphates and carbamates. We have pyrethrins, pyrethroids, and permethrins. We have amitraz, macrolides, fipronil, neonicotinoids, and spinosins. And some of these will focus on more heavily than others. So I will definitely draw attention to the ones that you need to know about. So with this, organophosphates and carbamates, these are older forms that more are being used now for pesticides for plants. So we're seeing them more now, so not from direct application to animals, which is good, but we're seeing them as a secondary ingestion because the animal has eaten pesticides that are being used for plants. However, in the past, some people had used organophosphates and carbamates as a form of ectoparasite control. So the reason you need to know about these ones, it's not because we're recommending them in vet medicine, it's not because we're directly applying them to animals, but a lot of animals come into our clinics each summer with organophosphates and carbamates toxicity. So there's potential host toxicity, so it limits the veterinary use. So again, we're not using them directly in vet medicine so much anymore. And the toxicity is seen from non-animal uses such as garden pesticides and lawn grub killers. The mode of action, the way organophosphates and carbamates work, they inhibit acetylcholinesterase activity at both the nicotinic and the muscarinic receptors. Sorry, I'm stumbling here. So what they're doing, they're inhibiting acetylcholinesterase. So we've talked about this previously. Acetylcholinesterase comes in and it breaks down acetylcholines at the neuromuscular junction so that acetylcholine is no longer having that stimulating effect on the muscles. So if we're blocking acetylcholinesterase, then we're blocking that action, and acetylcholine will have continued or prolonged effect on the muscles that it's affecting. So what we end up getting is overstimulation of the parasympathetic nervous system. So we get salivation, lacrimation, urination, defecation, dyspnea, and emesis. And then we're also getting tremors, shaking, ataxia, and then paralysis. So essentially we're getting this huge overstimulation of the parasympathetic nervous system and overstimulation of the muscles, so direct with the neuromuscular junction. So what ends up happening are these poor animals who have ingested organophosphates and carbamates come into your clinic looking like this poor kitty here. And they're just twitching. And it's really awful. And they twitch and twitch and twitch, again, because that acetylcholinesterase has been blocked. So this acetylcholinesterase, which normally blocks acetylcholine and it sort of breaks down the acetylcholine, it's being blocked. So acetylcholine, which is the neurotransmitter here, is just going to continuously have an effect on the muscles that it's connecting with. So it's really scary, and of course the twitching will continue and it will increase to the point of tremors, and then they do get overheated, and then eventually they get paralysis. So it's really awful. They have difficulty breathing because their diaphragm is also twitching and then undergoing paralysis. So keep that in mind. It's a very, very scary effect. So the treatment is to remove any residual pesticides. So if they have it on their paws, if they have it on their fur, we need to get it out of there. If they've ingested it, which they have, if they're having these side effects, then we often we're inducing emesis to get them to vomit, get that toxin out, and then administering charcoal. One thing that's interesting is that we can use the drug atropine, which is an anticholinergic, and we can use it at 10 times the normal dose that we would use it for pre-anesthetic. Not uncommon for us to grab the atropine in these cases, and then of course nursing care and supportive treatments. One thing to note about organophosphates and carbamates as well is that they're super, super toxic to fish. So why do we care about that? Oh, I'm just going to go back, sorry. Why do we care that they are toxic to fish? Well, we're not really using them in vet medicine so much anymore, which is good. But if we are using them for large animals, let's say, we have to note that the toxicity to fish makes us want to avoid using them around rivers, streams, ponds, and things like ornamental koi ponds, etc. So it can have massive environmental impacts. And that just goes back as well to people who are using organophosphates and carbamates as a way to kill pests in their farms and in their agricultural setups. Definitely can have a massive impact on our fish environment as well. So the key there with organophosphates, they definitely overstimulate the parasympathetic nervous system, and they also overstimulate the muscles. And most often we're dealing with patients who have accidentally or inappropriately ingested them, and it's causing massive muscle tremors. Pyrethrins and pyrethroids are another class of topical anti-ectoparasiticides, and these ones we do prescribe in clinic, and these ones you'll also find in pet stores. So pyrethrins and pyrethroids are a large group of selectively toxic and relatively safe over-the-counter insecticides. The small doses are toxic to insects, and large doses are toxic to mammals. So these ones are interesting. They absorb into the skin, but not into systemic circulation, and they cause spastic seizures or paralysis of insects. Spastic seizures, so they maintain open sodium channels. So if we're looking at depolarization of the nervous system, of the nerves, if we maintain open sodium channels, then we're causing an overstimulation of the central nervous system, and we're causing constant depolarization of neurons. Likewise, some of these products cause paralysis, so they lock the sodium channels, so they close the sodium channels and lock them, which prevents depolarization. So they have one of two methods that they work, and sometimes these drugs, so these pyrethroids or pyrethrins, are mixed with other drugs, other antiparasiticides, which might then make them systemic and might classify them more as legend drugs rather than over-the-counter. So pyrethrin is a natural derivative from the chrysanthemum flower, and it provides this rapid stun, so this knockdown but slow kill effect of fleas and ticks. Pyrethroids are modified pyrethrins, and they kill more effectively, so they have a faster kill rate. Pyrethroids and pyrethrins, so looking at the one that we most often see in clinic, we have permethrin. So permethrin is an example of a pyrethroid, and it's found in over-the-counter fly sprays, in canine Advantix, and in the States, it's found in the product Activil Plus. So this product, permethrin, attacks the flea or tick's central nervous system, and it causes paralysis. If they feed, they don't die right away, but instead they bring home the meal to their kids. So they're starting to paralyze their kids. So we're starting to work to reduce the overall population of the ticks and fleas. Interesting, and one thing that they have on label is that it also works as a repellent. So in some cases, depending on the product, but in general with advanced ticks, it doesn't need the tick doesn't need to bite in order to work. So Advantix is beneficial in that way because it definitely repels the fleas and ticks, but also if the fleas and ticks do decide to go ahead and bite the dog, then they're definitely going to bring that product home to their kids and reduce the overall population. Pyrethrins and pyrethroids are definitely contraindicated in cats. They are toxic to cats. And the way the toxicity occurs, the cat would have to lick the application site or lick the paw that touched the application site, and then serious toxic effects would occur. So looking at that, what we do, we definitely recommend that cats never, ever, ever be treated with Advantix. So this is our product in Canada that we most often use as an example. And likewise, we have to be very careful with clients who are going to the pet store to purchase a tick and flea medication. Most of these products are now doing their due diligence and they're having a picture on the box that says do not apply to cats. However, the client should always be cautioned that in general, we recommend against flea products for cats that are sold in the pet store because there's just too much chance of a mix-up, and cats could get the very, very, very toxic permethrin. So also things to think about if the doctor is prescribing Advantix for a dog, we should always have a talk with the owner. Do they own cats? If they do, it's recommended to separate the cat from the dog up to 48 hours after we apply this medication to the dog. So up to 48 hours. In your textbook, if you read the textbook, they had an example where Advantix was applied to 2 large dogs and 48 hours later, the cat was undergoing toxic effects. So again, if they have cats, really, really scary if they ingest this. If the cat and dogs are really good friends and they groom each other, definitely 48 hours is the bare minimum to separate the animals before or after the application to the dog. So permethrin, the main ingredient that we're concerned with here, relies on glucuronide. My words are not coming lately. Glucuronide conjugation in the liver. So this is from chapter 3 in your text. So looking at that form of conjugation in the liver, cats are really inefficient at this type of metabolism. So what ends up happening is it takes them a really, 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 really long time to metabolize the drug. So with that, if the metabolism is slowed down, then of course we're going to reach super toxic levels in their body. So that's why they get this toxic effect and dogs do not. This causes tremors and seizures and potential for death. Treatment, it requires immediate treatment, bathe to remove any excess product. So if they have contacted the product, if the owner accidentally put the product on them, we need to get them bathed right away. But of course, remember that they have to ingest the product for it to be toxic, completely toxic in this effect. Intralipid therapy that we talked about the last lecture, there's potential that we could try that if it's severe. And then we look towards supportive care. So oftentimes we're giving them methocarbamol, which is the main ingredient in Robaxin. Propofol, sometimes we'll use a titrated propofol dose to sedate them to reduce these muscle spasms and tremors. And we can also use diazepam to reduce some of these muscle spasms and tremors as well. So this is an example of a cat who had pyrethrin toxicity. So it had permethrin applied, which is the main ingredient in Advantix. And this is a cat who's already undergone supportive care. So she still has tremors that you can see, but she would have been tremoring much more severely when she first came into the clinic.
Flea prevention. much less than they were before. But treatment of choice is trying to control the tremors and fluid therapy to flush out the toxins, supportive care until that toxin has a chance to minimize and to be excreted out of the body.
So again, cats have an issue metabolizing that drug because they cannot metabolize it in their liver as fast as dogs can. So then it builds up in toxic doses and they get these muscle spasms and tremors. So again, going back to client education, super important. If you're treating your dog with Advantix, which we look at, permethrin is the main ingredient, separate the dog and cat. So I think Advantix says 24 hours, but realistically, 48 hours is the absolute gold standard, especially if the dog and cat are friends and they're likely to connect with each other. Other examples of pyrethrins and pyrethroids, cypermethrin is most often used in poultry operations, and you can see it as ear tabs in cattle. So if you look at the bottom right picture there, they're little ear tabs that are attached to the ear tags, and they have the permethrin on it. You can find it as well mixed into dust bags so that cattle rub up against them. Likewise with poultry, but in general, we're not using this product for small animal use. This is a product that's also found in many household insecticides, so things that we use in our gardens to kill off insects. And then there are many others out there. So fenvalerate is Hart's. That's the one that used to be a common product in the Hart's flea and tick products. It killed a lot of cats, so they've removed that, as far as I know, from the market. We have Atenofenprox, which is, along with fipronil, the main product in Frontline, which is I believe it's flea and tick in the States, a product available in the States. And then it goes on and on. The Serestro collar, which is the one at the bottom with flumethrin, that so far is currently only available in the States, but it's becoming very popular in the States. So you may see it creeping up into Canada, especially if you have clients that go to the States for the winter and come back. So again, a lot of these products, just because we don't have them in Canada, we still have to know about them. Unfortunately, it just adds to our burden, but we have to know about them because a lot of our population shares geography with the States. A lot of our population goes down to the States for half of the year to avoid our evil winters. So again, pyrethrins and pyrethroids have caution around fish if we are using them in small animals. So if dogs are wearing flea and tick collars that contain pyrethroids, or if they're using high doses of permethrins, such as Advantix, then definitely just keep in mind it can kill fish. So if the dog, if the dog regularly swims in the ornamental koi pond, then you need to let the owner know that definitely 48 hours at least until that product has fully dried, and ideally keep the dog out, but at least 48 hours to keep them out of that pond. So amitraz is another form of tick prevention, technically. And the way we find it here in Canada is most often as a collar. So it's most often found as the Verbach Preventic collar. The method of action, it's an alpha-2 adrenergic agonist and an MAO inhibitor. So a monoamine oxidase inhibitor. Now, monoamine oxidase inhibitors you guys will talk about next semester when you start talking about behavioral modification drug. But right now, we have talked about the alpha-2 adrenergic agonists so far. And if you think about when we've talked about those, an example drug that is an alpha-2 adrenergic agonist is dexmedetomidine. So we had talked about dexmedetomidine as a way to induce vomiting in cats. And then remember, as a side note, it's also used heavily as a sedative agent. So the way this product works is essentially it sedates the tick. So it's using those effects of the alpha-2 agonist to sedate and to knock the ticks off the patients. So it's kind of interesting because if an animal gets an overdose of amitraz, because it is an alpha-2 agonist, we can actually use an alpha-2 antagonist drug. So we know that our alpha-2 drugs are reversible. So we could use adipamazole, which is antecedent, to reduce any toxic effects if a dog or a cat has ingested too much amitraz. So it's kind of interesting. That being said, how would this animal get this? How would they overdose on this? So the main thing I always think about with these, because they're available in a collar form, you guys have all met Houdini dogs. So this is a product that's on label for dogs right now, not cats. You've met Houdini dogs who pop their collars off all the time. So if a dog Houdini's out of their collar and then they chew their collar and they eat their collar, i.e. if you own any lab in the world, then they could potentially overdose on amitraz and they could be sedated. So that being said, the dog would come to the clinic and then there's potential that the vet could administer a reversal such as adipamazole and reverse the effects. So this is again a tick treatment, a tick prevention. Most often we're going to see it in Canada as a collar. One thing to keep in mind, contraindication. So this is something that might come up in a case study potentially, but in general, something to note, these products, the products that contain amitraz, are contraindicated when a patient is taking many of the behavioral modifying drugs because a lot of those behavioral modification drugs contain MAO inhibitors. And so we can get into issues with serotonin and with sedation. The other method, so we don't have it so much here in Canada, but you can use a dip. So you can use amitraz as a dip for demodectic mange. I have to double check, but I'm pretty sure that we don't have Midaban dip here in Canada, although things come on and off the market very quickly and very routinely. So if you are involved in using a Midaban dip, definitely wear gloves. And keep in mind that if you're using a dip, that sedation and ataxia is possible 24 to 72 hours after the dip, as well as potential for hypothermia. And of course, the sedation and ataxia is because it's an alpha-2 agonist. You can also get a little bit of itching, and it's effective against Demodex. So in severe cases, we might be getting in a Midaban dip for demodectic mange. And then, like I said before, the Preventic collar made by Verbac effectively repels and kills ticks, and we do not use it in cats. This product in general is toxic to cats, as most of these products are for ticks. It's also toxic to humans, so keep that in mind, hence wear gloves if you're touching this. Also important to note, if your animal's wearing one of these collars, please keep it out of the reach of kids. Kids like to hug dogs, and we know that this is a toxic product. Moving on to macrolides. So we've talked about macrolides quite a bit, so I won't go into too much detail about them. I've already covered the majority of this when we had our macrolide talk, so I don't want to overwhelm you once again. But ivermectin, doramectin, eprinomectin, selamectin, milbemycin, and moxidectin, they all have internal as well as ectoparasite control abilities. Milbemite we're talking about in general, ear mites overall, not so much internal parasites. That product, but milbemycin has on label for both. So just keeping in mind that macrolides, except for certain products such as milbemite, which is only ectoparasites, most macrolides are endecticides, so they work for both internal and ectoparasites. Now that being said, I'm just going to go back. One little thing about macrolides, so if we're using a topical product like Revolution and Advantage Multi, if we are using it for ectoparasites other than fleas and ticks, fleas and ticks, other than fleas and ticks, if we're using it for things like mites, we have to look at the label all the time because a lot of times they require additional treatments. So an example is Revolution for fleas. It's a once monthly treatment. Same with ticks. It's a once monthly preventive treatment. If we're using it for ear mites, it tends to be every 2 weeks that we have to use it. So just things to keep in mind that your dosing may change. All right, Fipronil. This is a U.S. product, so it's available over the counter in the U.S. We don't have it here, but your clients may come home with it. So looking at, we have Frontline, we have Certifect, and Parastar are the products that contain Fipronil. Mode of action is a chloride ion blocker leading to nervous system overstimulation. So again, it's messing up that depolarization and repolarization of the neurons. It has high affinity for insects ion channels, so it works really, really, really well to create this nervous system overstimulation for insects. It's available over the counter in the States, so again, a lot of clients come home with this. Dogs and cats, it can work toward prevention and killing flea, ticks, and lice. It's deadly to insects and fish. It's safe for mammals, but it's recommended that we wear gloves because I believe this one had some studies where there was potential for defects in mice. Now, one thing to keep in mind if clients are purchasing it, you'll note the Frontline Plus for dogs. There's also a Frontline Plus for cats. They cannot apply the Frontline Plus for dogs to cats because it will have added ingredients that are toxic to cats. So this is super important for clients. They cannot share products between dogs and cats, and important not to bathe the patient for 48 hours after application. So one that we do have here are neonicotinoid products, which include Imidacloprid and Nitinpyram. And I would say that Imidacloprid is one of the most common flea products that you are going to sell at your vet clinic. Now, Imidacloprid is also identified now as over-the-counter, so this is Advantage and Advantage 2. I think they took the legend labeling off this probably about 3 years ago now. So there is a little bit of controversy around Advantage, which its main ingredient is imidacloprid, because it technically should be available over the counter. However, a lot of vet clinics currently would like to recommend that the client have an exam, and they're selling this as a legend drug. So that's something to be aware of. I would definitely connect with the vet that you are working for before you start describing it to owners as an over-the-counter product. Just make sure that you are matching up with them to know what they're expecting from clients and how they would like to dispense this drug. So that's a side note. Either way, imidacloprid and Nitinpyram mode of action, it binds preferentially to insect nicotinic acetylcholine receptors, leading to overstimulation and paralysis. So it's paralyzing the fleas. It works well against dog and cat fleas, which is fabulous. So you'll see it a lot. Capstar is Nitinpyram, and we'll talk about Capstar here in a second. So if we go back to Advantage, which is imidacloprid, that's a once monthly treatment, works wonderfully for fleas. In order to get the full flea life cycle, what they recommend is that you treat with Advantage for 3 months in a row. And that, along with house hygiene, such as vacuuming and cleaning, should get that entire flea cycle. So it's not just a one-time use. Capstar, you give to the animal. It's an oral treatment. Give to the animal, and within 30 minutes, those fleas are falling off that dog and cat, and they are dying. It's amazing. I think I have a video. Let me check here. But it's a pretty amazing product, and most often we're using Capstar for animals who have fleas and are going into a non-flea-based household, or if we're taking an animal into a clinic and we want to knock the fleas off of them.
This is my cat Francisco after his first treatment with Capstar. It's about 30 minutes after we gave him the pill. And this product is amazing. You can see all the fleas that have already fallen off of him. And it's only been, like I said, about half an hour.
Look at all those dead fleas.
All the dead ones.
How exciting.
And then if you look close, you can see that there's ones that continue to fall off of his fur. I don't see one right now. And every now and then you'll...
So good. I love that video. It's so, it's so basic, but it's so good because it's really showing that using Night and Pyram, which is the main ingredient in Capstar, you literally give them an oral tablet and within half an hour, fleas just start falling off the patient. And I love it. And you can sit there and take a little bit of joy in watching these fleas die because that's what we take joy in. So Imidacloprid, going back to this one, that's the Advantage brands. You can find it in the collar. So Serestro, which we don't have in Canada, it contains flumethrin to work against ticks, but it also contains Imidacloprid. So again, Serestro collars you might get from clients who are going to the States. Remember, if it's a Serestro collar, because it contains flumethrin, that's a pyrethroid, do not use it on cats. Imidacloprid overall is held in the lipid layer and in the hair, so it stays on the skin, and it kills fleas on contact. It also kills biting and sucking lice, and it has super low toxicity for the animal. So they have studies which, like, the animal has accidentally ingested imidacloprid. They have studies where the owner has given like 10 times the dose by accident, and it's insanely, insanely safe, which is nice. And it's safe for cats and dogs, imidacloprid itself. Just to note, so the topical aspect, it spreads across the skin in 24 hours, so no bathing for at least 24 hours. You could always say 48 hours as sort of a saving grace, but 24 hours for sure, and no swimming for 24 hours. And looking at this, what it does kill, it kills fleas on contact, so we're talking about adult fleas, and it kills larvae. So this product does not kill flea eggs, and it does not kill the pupa of the fleas as well. So again, going back, we have to do that 3 months in a row if you have a current flea infestation to ensure that all of those life cycles are killed. Moving on to Night and Pyram, which is the main ingredient in Capstar. It's an oral tablet. It has low toxicity and it's safe during pregnancy, which is really great. Again, if you have shelter cats that have an active flea infestation, we can give this, help them out. Most often, it takes about 30 minutes for onset of action, and it has 6 to 8 hours before the peak activity. So we should see that patient pretty much flea-free by 6 to 8 hours, which is pretty amazing. Elimination, it is unchanged in the urine, and so that means that, it's unchanged in the urine, and it also has a very fast elimination. So that being said, 24 hours, this product is unchanged, eliminated in the urine, and with cats, 48 hours, it's unchanged, eliminated in the urine. So that being said, it does kill adult fleas, and it can be repeated daily. Because it has such a fast elimination through the body, so 24 hours later, it's completely eliminated from the body, and cats fully in 48, it can be given daily for these guys to ensure consistent and constant flea control. One thing that you may notice after giving a Capstar is the animal may start itching like crazy. So shortly after giving the Capstar, when the fleas are starting to die, these adult fleas, as they're starting to die, the itching will get really, really insane because the fleas are frenzying before death. So they call it like the death dance, and their little muscles are twitching, and the fleas are going crazy. They're dancing all over. So they frenzy and they move all about, and the dog and cat get really, really itchy because of this. One thing that's recommended for this product is to use with a longer acting combination drug, such as Lufeneron. So the maker of this drug, who I'm gapping on at the moment, but the maker of this drug typically recommends that you pair it with their other drug program, which is, I don't have a video right here. I'll go to the next one because we've already seen this video. So they recommend that you pair it with program, which is a 6-month flea control injection, in order to maintain this overall control. So we pair Night and Pyram, which is Capstar, with program, which is Lufeneron, and then we've got the adult fleas being killed by Capstar, and then we have the rest of the life cycle essentially killing, sorry, I'm gapping there a little bit, the rest of the life cycle being killed with Lufeneron. So it's this continuous cycle that's ensuring that the flea population is killed initially, and then the rest of the life cycles are being killed. So Program and Capstar, i.e. Nitenpyram and Lufeneron, are the two products that's recommended to take together based on the company. So then we carry on to insect growth regulators, or IGRs, and then we also have insect development inhibitors, so same idea within the same category. So Lufeneron, one example that we just talked about was Program, which is that 6-month injectable form of flea control. Another one we have is Sentinel, which used to be super popular in Canada. It used to be really, really popular, and now it's just completely gone out of favor. The reason that these ones go out of favor, is if we go back, remember that clients really want an all-in-one product, and a lot of these ones are not. So you can see that here. They have changed Sentinel to be a combination product. It's now milbemycin with Lufeneron, so it's going to get some endoparasites as well as fleas. People are wanting better control. People want an all-in-one, easy application product to get everything, to be heartworm, to be flea and tick and everything. So Sentinel is a good product. It gets some internal parasites. It definitely controls fleas, but I found it's just getting out of favor with clients. The way we give Sentinel, it's a monthly oral dose, and it's absorbed into the bloodstream and through the tissue fluids. It's ingested by the biting fleas, so of course the fleas have to bite in order to get it. And it interferes with the chitin deposition in flea larva exoskeleton and eggs. So essentially, it's killing the larva. It doesn't kill adult fleas. So a lot of people don't like that. And that's why I think in part Sentinel is getting sort of pushed aside for other newer, more effective products. And when I talk about how it works with affecting the exoskeleton of the larva and the egg, what that means is essentially the flea larva and the flea egg becomes leaky. It becomes inefficient, so then it can't grow and develop to adult form. Mammals do not have chitin, so then they're not going to get affected by these, which is nice. It makes it fairly safe for mammals to have overdoses if that happens. And then which other product do we pair with Sentinel? Well, we could, of course, if we want to ensure that the whole life cycle is captured, we could pair it with Nitenpyram. So we could pair it potentially with Capstar to help with getting that entire life cycle of the flea. One thing to note, it does have a 2-week lag time before we will start to see the adult fleas being killed, and I would say this is honestly the biggest reason why people don't use it anymore, because we're talking about larvae and eggs being killed and being destroyed. It takes 2 weeks before we're going to start to see an effect on the adult fleas. So if we go back to some of our other products that work on contact, this is a problem. This puts this one sort of in the historical aspect rather than current. And then moving on to spinosins. We don't have many of these in Canada. I believe Comfortis might be one that is coming soon to Canada if it's not here already. It may be here already, but some of these have come to Canada and then have been removed from Canada for various reasons. They're no longer approved. So looking at spinosins overall, they're sort of the natural product, or they used to be seen as the natural product from sugarcane, soil, and from a bacteria, natural bacteria. But more so, spinoside is the chemical derivative, and that's what's being used in products now. The mode of action, it overstimulates the nicotinic acetylcholine receptors, just like neonicotinoids, and it inhibits GABA-linked chloride channels. So GABA is an inhibitory neurotransmitter that causes a sedating effect. So looking at spinoside, we have Comfortis, which again you may see in Canada, and it's a monthly chew for fleas, and it's for dogs and cats, so that's a benefit that it's dogs and cats. And it's sort of that original, naturally derived product. It can cross-react with ivermectin at high doses to cause some of those CNS effects. Just keep that in mind. The main reason you would need to consider that is if the patient has been treated with Comfortis and then they have, a serious Demodex infection and the vet's giving them a high dose of ivermectin, there's potential for cross-reaction. And then we have spinetoram, which is Shuristin, which is specifically for cats, and I believe this one still is only in the States, and it uses the same base ingredients, and it's a monthly feline topical agent for fleas. Carrying on, we have isoxazolines, which is oral flea and tick insecticides, and these ones you'll definitely see in Canada. These ones are becoming very, very popular for flea and tick treatment. So we have alfoxylaner, which is NexGard, and it's a monthly oral chew, dogs only. There is some documentation about a need for caution with dogs who have had seizures in the past. So it's important to note that some dogs who received NexGard over time, they had seizures. Some of them were immediate, some of them were within days, weeks, and months of dosing. And then Fluralaner, which is Bravecto, the main ingredient in Bravecto, is every 3-month oral chew for dogs, and it's a 3-month topical for cats. Lastly, we have Seralaner, which is a monthly oral chew for dogs. The way these ones work, overall, it's nerve overstimulation by inhibition of GABA-linked chloride channels. Excretion is through the liver, so we have to be very cautious in animals who have a compromised liver. It's a very highly protein-bound drug, which allows for extended duration of the effect, especially if we're looking at Bravecto. It's very, very highly protein-bound. So that, remember, the contraindication would be in animals who are proteinemic, hypoproteinemic. And side effect with normal dosing, some animals experience vomiting, especially I think it was found with Bravecto. Regardless, normal dosing or not, a lot of animals experience vomiting. So things you want to know about these is definitely the brand names and what product they contain, and then the general differences between them. So we've got Bravecto, which is a 3-month oral chew for dogs, 3-month topical product for cats. Seralaner, which is Simparica, monthly oral chew for dogs, and NexGard, which is a monthly oral chew for dogs. As well, remember that the potential for seizures in seizure-prone dogs with NexGard. And then something new to know about, which I don't have noted here, of course, is remember that every product has to outdo themselves each year. Well, NexGard now is NexGard Spectra, and they have, they've added, I can't remember which product they've added because I'm gapping at the moment, but they've added, I believe it's a macrolide to increase the spectrum for heartworm prevention as well. So you'll get to know these drugs, and then the companies will reinvent them as something amazing and brand new, and you'll have to learn them all over again. I'm just gonna, just going back. So, and then we have indoxacarbs, which is another class of ectoparasite control. I'm not too worried about these ones. We have these not in Canada, but they are in the States. The main thing is that for Activil itself can be a treatment for fleas on cats with some tick as well. If it says Activil Plus, that's the main thing we need to be aware of, that all of a sudden it now contains a permethrin, which is super toxic to cats. So we don't have Activil here in Canada, but it is in the States and it contains indoxacarb. And we talked about insect growth regulators overall. Oopsies. So just going back to insect growth regulators, we talked about Lufeneron, looking at some of the juvenile hormone analogs. One thing, let's see. The main thing I want you to know about is the drug methoprene, which is found in Frontline Plus, and the Ovicolor, which are two things that you would find from clients coming back from the States. Does not kill adult fleas. So in general, when we're talking about insect growth regulators, such as Lufeneron, which was Program, it does not kill adult fleas. So it's looking at killing some of the other life cycles of the flea. So insect growth regulators, carrying on, we have pyriproxyfen, which is a product found in Nylar, which we have in the States, not here. Canine Advantix and Advantage 2 has imidacloprid as well as pyriproxyfen. It's safe in cats. So not only will now the imidacloprid get the adult fleas, the adult fleas, we've got pyriproxyfen, which will get the larvae and the eggs. And it's halting the development of the larva, so it's preventing that life cycle from carrying on. So sorry, those insect growth regulator slides were supposed to be a little bit further in advance. So when I post this for you guys in your lecture, I will make some edits and update that for you. Carrying on, lastly, to insect repellents. Just note that insect repellents exist. More so, we're looking at insect repellents for horses and livestock. Sometimes we can see them being used for dogs as well, but there aren't very many that are available and safe for dogs. A lot of the ones that we're using in large animal, we've got permethrins, and then we have Butox PPG, which is one that you might see. It's a dog and cat flea and tick spray. Generally, we're not using a lot of sprays in dogs and cats. So keep that in mind, most often for large animal, and I recommend that you do not use your large animal sprays on dogs and cats. Another natural spray that a lot of people use as just a repellent for horses and cows is a citronella-based spray. People ask if you can use it on dogs and cats. You can, but dogs hate the smell of citronella, so I highly advise against it. And then some people recommend using DEET. Some people, as in not veterinary staff, try not to use DEET on your pets, even if you're in a highly mosquito-infested area. They can get toxicity from DEET, and the toxicity appears like organophosphate toxicity. So we can get excitement, tremors, seizures, ataxia, vomiting, etc. So this is something to keep in mind. Most often with repellents, we're looking at large animal repellents. And then here's a happy little video to end off our lecture. Before I play this video, I'll let you know it's really gross. And it's a Reba that's stuck in a kitten's nose. And it's a little bit heart-wrenching to watch because it's a tiny, tiny little kitten. But just know that the kitten does really well in the end. The Reba is removed and the kitten gets rehabilitated and it ends up being adopted. So just keep that in mind. If you want to watch it, watch the next few seconds.
Get your brave on.
Ew. Poor kitten. Oh,
Whoa!
poor
Poor
kitten.
baby kitten. That is huge.
Oh, isn't that gross? Poor baby kitten is right. Poor little thing. Okay, so then just a quick note, because there are so many drugs that we have to get to know. The ones that I went into great detail are good to get to know. Ones that are very common would be good to get to know, most definitely. We talked a lot about macrolides previously, so of course getting to know your macrolides and who they're toxic in, who they're safe for. Overall, looking at our products and getting to know which parasites they can kill. So if we're talking about a flea product versus a tick product, that's important. And then of course, who they're toxic for and who they're contraindicated for. In your textbook, table 12.3 has pretty much all of the products listed. However, important to note that a lot of these products are not available in Canada. So when you guys are organizing your own charts for your clinics and for your own learning going forward to be working in a small animal vet clinic in Canada, just make sure that you're crossing off the ones that are not applicable to Canada, at least as a quick reference guide. Getting to know the basis behind some of these products that are in these American versions, that is sort of a need to know information. But for quick reference, as a tool that you'll literally use in clinic all the time, especially during flea, tick, and heartworm season, just make sure that you're omitting products that are not applicable. And that is it. That is our last antiparasitic talk for this semester.